I'm joined by Dr. David Rutstein from Beijing. He's Vice President for Medical Affairs at United Family Healthcare in China. Well, talk to me about the significance of Child Vaccine Awareness Day.
Well, anytime you have a national awareness day, it obviously is meant to create such awareness. And this is particularly important in a huge country like China, where multiple populations spread over vast distances require vaccines that have to make their way to those people and injected into those children in a safe and an effective manner. So having a day that heightens the awareness of this process and the importance of vaccines will go a long way, I believe, to help engender confidence in the system.
Dr. Rutstein, let's talk a little bit more about the fact that it is a very vast country. China now demanding more accountability following the scandal we just talked about, which involved improperly stored vaccines which were sold nationwide. What steps can be taken to prevent something like that from happening again?
Well, this is a complicated issue, but the first step is to ensure that the vaccines that are produced are, in fact, of the highest quality. And just a few years ago, the WHO started issuing pre-qualification certificates to vaccines manufactured within China, which basically gave the stamp of approval for those vaccines to be used domestically and even exported internationally. Then there has to be a system that monitors and tracks both the storage and distribution of these vaccines. There are several classes of vaccines in China, Class A and Class B. Class A are the vaccines that are basically mandatory. Class B are the vaccines that are optional. Patients and parents can decide to purchase them and have those vaccines administered as well. Up until recently, there was a very stringent system for tracking and monitoring Class A vaccines, but the system was not nearly as stringent for Class B. So one of the things that can be done is to have the same system for all vaccines and then actually put teeth behind this monitoring and tracking system, such that if it breaks down, there are penalties to pay, and more importantly, that if there are adverse effects of any vaccines, that there's a system for reporting those effects, following up, investigating what the adverse effect was, and making corrections in any broken part of this long chain of vaccine distribution.
If all of these steps you just mentioned are adopted, do you think that's all that's needed to restore confidence in the folks there in China?
Actually, I don't. Vaccines are always an emotional issue with people, especially as science has advanced and we are able to create more and more vaccines for more and more diseases. This is a wonderful thing in that it protects children and others from terrible diseases that claimed the lives of countless people in the past. But when parents see their children being injected with so many different vaccines, that promotes an emotional response. They don't like to see their children being injected with so many vaccines. So even if there's a minor adverse effect, it tends to trigger a disproportionate reaction. So this kind of effort to both maintain and improve the confidence in the system has to be ongoing. There's no one solution that can finally conclude that, okay, now everyone has confidence in the system. It has to have a continual effort to devote resources, both public information resources and scientific analytic resources to ensure that the system remains robust and remains of the highest quality.
Dr. David Rutstein joining us from Beijing. Thanks so much.